Greetings everyone and welcome and happy new month. Merry Christmas in advance. Today is World AIDS Day. So what is AIDS? AIDS is acquired immunodeficiency syndrome. And HIV is human immunodeficiency virus. It will interest you to know that you could have AIDS, but you don't have HIV. In a layman language, would say that having AIDS means your immune system don't reduce its potentials for carry out its functions because it's the immune system that defends the body. It's the body's defense mechanism. Yeah. But so our focus of today is to see how we could possibly prevent the spread of the HIV virus and how to go about it if you go to the hospital and your result comes out positive. Okay, I think we'll start first with the results. Now, it's said that you should do your checkup after 3 months, every after 3 months. So if you go to the hospital and you do a checkup, there are stages. We do checkups before we proclaim that you are truly HIV positive. Now, if you go for a determine, you go for the first checkup, they will use the determine, that's a strip. You can't know, we the medical personnel, we know. So when they do the determine test and it comes out positive, it doesn't necessarily mean you have HIV. Now, the determine is not specific to a particular virus. So the moment you have any viral infection and you do the HIV checkup with the determine, it is possible for it to come out positive. But that doesn't mean you are HIV positive. After that, the lab technician or the medical doctor, whereas the person attending to you, will send you to go in for confirmatory exams. But oftentimes, because of pressure, when we go for the first check and it's positive, we just grace. Mama, I will kill my master today. Maybe if you are married, I will kill my master today. I will kill my woman today. So you just start being tense for nothing. Now, so what I'm trying to say is, when you go for a check and your result comes out positive, please don't panic. And I could understand that it's not easy, but listen to what the doctor would tell you, be it the doctor, the lab technician, or the person attending to you, because there's a probability that after they determine it's positive, you could go for the confirmatory, the oral quick, there are 3 stages, and all comes out negative. With the determined result, you are not 100% HIV positive. From there, you go for the confirmatory. There are other 2 more steps ahead to be done. So when the 2 other steps are done, the results that we will have from the 2 other steps, that's what we will consider as your result, your HIV status. So please, if you go somewhere and they do the first test, it comes out positive, don't kill yourself. Many people have committed suicide for nothing. Just be like, okay, I'm not going to die, I'm not going to feel it. No, we don't do that. And in case you go for the confirmatories and all comes out positive, that's not the end of it all. HIV is not a suicide mission. Gone are those days where people were stigmatized because they were positive. In our days now, HIV is very much more preferable than other sicknesses. Though it's not something we pray to have, but if it happens so you are a victim, there is still much more hope for you. You just need to follow your medication. And the good thing is the treatment is free. The treatment is free, but I'm not saying you should be careless with yourself. What I'm trying to say is, in case you are a victim, don't kill yourself. There is still much hope for you. There are people who have lived their lives of more than 25 years as being HIV positive patients. So please, in case you are positive, don't run away from treatment. Please, there is still much hope for you. You just need to look for a nearby hospital where you could go for continuous follow-up or register in a government hospital. I know some people will be like, I don't want to go for that hospital. So my neighbor they work for them. So my in-law they for them. So my friend could also get it. If you're not comfortable with that hospital, you can look for another hospital. Maybe move out of your town. You don't go to the hospital to take extra just there every day. There's a rendezvous protocol for every month. So if you look for a nearby town where you could go in for your treatment, when you have your proper rendezvous, you go, you take your drugs, you come and you take it. Nobody will know that you're positive. So free yourself, because the first point for you to be healthy is to work on your psychology. Now, while the HIV victims, they are feeling somehow to handle or to go about the treatment, most of us youth who are negative, we careless with our lives, especially us, the younger generation. Those of us in our 20s and our 30s, we just do things anyhow. You be like, hey boy fresh. No, you not get sick, you not get sick, you not get sick. You know, if you find you not get sick. And the most pathetic thing of it is that we fear pregnancy than any other thing. You see a girl will be like, I know I'm born it. I know I'm born now. You could your family planning, but you never marry. You know every more one picking, but you do family planning because you want to feel free. And the question I will ask is, the person you're feeling free with, do you know that person's status? So on this day, we encourage and advise everyone, know your status and that of your partner. If you're not married, the guy you're dating, the girl you're dating, know the person's status. It's very important. And when your confirmatory scans are positive, make sure you go to check the viral load to know how it is. Knowing the viral load will help us to know how to help you in this situation. Many people die with HIV because they hid it. They try to keep it a secret. No, if you want to keep it a secret, make sure you have a medical personnel, medical doctor whom you confide in, who would help you out with treatment. So, my advice to the youth is, before you get anything to do with someone, make sure you know that person's status. Don't speculate. We don't estimate in health. There is no speculation or guessing in this stuff. Don't be like, it's all fine, I'm not sure. Say, you get that, you don't get that. What we don't know is, out of the 100% HIV cases, positive cases, 85% happens to be youths. It will surprise you to know that there are people who are 20 years but positive. Not because they got it from their parents, they got it from boyfriends, girlfriends, from sex partners. So please, don't be careless with yourself. Don't have yourself to blame at the tail of the story. There's a possibility for you to keep yourself plain. And note, sex is not the only transmission means of HIV. There are other modes of transmission, using of blades, coming in contact through transmission of blood and other stuff. But the most wildest and loudest mode of it is through sex. Unprotected sex with an infected person. And in case you have someone around you whom you know is positive, please don't make that person feel stigmatized. HIV is not a death sentence. Make them feel loved. When I was still much younger, some people would be like, it will chop you. It gets sick, not chop it chop. It's wrong. When you do that, you are stigmatizing the person. They make the person to feel unloved. The person just feel like, no, he or she maybe is a demon or something like that. It's not good. Show them love. It's not a big deal to eat from the same dish with an HIV infected person. The other thing is, avoid contact, close contact. Maybe me not bite, me give you bite that, because if you get blood for you, more other kind of thing. So that's what you need to, not like you be like, no, come on me and not touch. No, please show them love. And if you know someone who is positive, while quarreling or when quarreling, not talk, say, come over here, HIV positive. It's wrong. And most of us don't know it's a crime by law. It's punishable by law, because that person has the right to sue you. So when you know someone's HIV status, keep it a secret. It's not a news to announce, not a good news for announcer. It's wrong. And in case you know someone who is positive and the person wants to marry or date someone you know whom is negative, there's a way you communicate the result in a model. Not be like, you man get it. No, you could sound like, say you were bad mommy before you want to give a to a person, for say you know how the person did. It's moderate, it's normal. They'll not be like that, HIV positive. No. So all in all, we advise you to keep yourself safe. Avoid unprotected sex. Abstinence is the best way to stay away and avoid contamination with HIV virus. And don't forget, in case you're positive, it's not the end of the world for you. There is still hope. You could live 30 years more. And in case you are negative, make sure you keep on doing your checkup every after 3 months. Thank you and have a nice day. In case of any question, don't forget I'm always available. Bye.